If you are struggling to lose weight between diet and exercise, maybe you feel like you've tried it all without any real success.
Well, if the number on the scale is holding you back from living your life, you might be a candidate for weight loss surgery. Bariatric surgeon Dr. Felix Spiegel with Memorial Hermann Memorial City Medical Center is joining us now with details on the NewStart program. Welcome to the show, first of all, Dr. Spiegel. Appreciate you being here. When we talk about weight loss surgery, I think a lot of people's ears perk up, but this is for a specific group of people looking to lose a significant amount of weight. Is that correct?
Yes, I would normally say this is for someone who needs to lose at least 50 pounds or more and maybe deal with some health conditions that are being impacted by their extra weight.
So 50 pounds, that's a good rule of thumb, but you also say like a BMI, body mass index, over 35 if they're dealing with some major health issues. And if their BMI is over 40, then you say even without those major health issues like diabetes, or there's a long list of
blood pressure, breathing
hypertension,
problems,
all of that, that they would be a good candidate.
Definitely over 40, they'd be considered morbidly obese, because even if they're healthy now, even if they're 20 years old, the risks are very high of developing these in the near future.
And the NewStart program with Memorial Hermann is basically tailored to that individual patient's needs and goals. And so when we talk about weight loss surgery, it's not cookie cutter. It's not one option for all patients. There's actually several options.
Absolutely. There's at least 4 options for patients that have never had surgery, and there are revisional options for patients that had failed surgery in the past. And I try to customize for each patient. I try to give them the option that I think is best for them, not just for everyone.
And Dr. Spiegel, I see that you have performed more than 20,000 weight loss surgeries. That's impressive. I know it's changed a lot. It's now all done laparoscopically. And let's draw the distinction for some of our viewers, because I think that some people may hear about a weight loss surgery and assume this is a cosmetic, almost like a plastic surgery. This is not that. This is potentially a life-saving surgery.
Absolutely. This is done for medical reasons, to make someone healthier and give them a much better quality of life, and of course to lose 50 or 100 pounds. And there's no reason they can't have cosmetic surgery later if they need to do a little tuck here and there. But this is not cosmetic surgery. This is metabolic and bariatric surgery done for health reasons.
And this is all about losing weight. And a lot of people who are dealing with this have some other underlying problems, as you mentioned, diabetes and heart issues. So in order to get that under control, the weight needs to come off.
Yes, and even young people who don't have heart issues or diabetes, they have chronic back pain from exercise, and they have knee pain, and they have heartburn, and they have sleep apnea. They don't sleep well because they snore. So by getting closer to their ideal weight, all of these conditions are improved or completely go away, and their lifestyle tremendously increases. Their energy, their hormone levels normalize, and they have a much better quality of life.
And doctor, is it true that some of the research shows that if someone undergoes a weight loss surgery like gastric bypass, they may be able to reverse some of these diseases even before that weight loss actually happens?
Yes, because the metabolic changes of the surgery are almost instant in some cases, such as diabetes or hypertension. Sometimes within a week, their primary care doctors, with my guidance as well, take them off the medications because of normalization of these conditions. And then the weight loss sometimes comes later. But the surgeries are very powerful in that way.
It's very fascinating to even think about that. What's interesting too is this type of surgery is for anybody in between the ages of 18 and 65. So even a young teen, somebody who's been dealing with weight issues their whole life, can just sit down with you and chat with you and really figure out what's the best way. The other thing, what I think is great, is that if somebody has had this surgery and whatever that procedure was and it didn't work for them, you also say we can do another one. We can try a different surgery.
Right, we can revise it, and that's one of the things I do a lot because of experience, and give them much better guidance than they might have had in the past. The aftercare, which only started being well done in the last 10-15 years. Before that, there wasn't as much aftercare. People just kind of had surgery and they just lost weight, and then they didn't have as much guidance.
And the guidance is a critical piece because obviously you want to keep the weight off, and by doing that, increase your life expectancy and longevity.
Absolutely. The guidance is like maintaining your car. If I tell all my patients, I want to see you at least once in 6 months, once a year after the first year, just to make sure that you're keeping the weight off and doing all the right things and taking the right vitamins, and just for a checkup.
Well, Dr. Felix Spiegel, very interesting conversation, and I understand this is the first of a few appearances, so hopefully down the line we can meet some of the people whose lives you've been able to change.
Thank you.
Thanks so much for stopping by. And in the meantime, if you would like to learn more about Memorial Hermann's NewStart program, visit mhnewstart.org, or you can call 713-448-7827.
And we'll be right back with more Houston Life.